Hello students, today we are going to discuss about the sterilization, that is terminal method, or we can say permanent method of contraceptive for the male and the female. So let's begin. So first we are going to see what do you mean by sterilization. So it is a medical technique that intentionally procedure where a person is unable to reproduce. So it is a method of birth control, and sterilization method includes both surgical and non-surgical and exists for the male and the female. Sterilization procedures are intended to be permanent. Reversible is generally difficult or impossible. So sterilization offers many advantages over other contraceptive methods, and it is a one-time method. So in a simple word, sterilization means it is a method of contraceptive. Okay, it is a permanent method which is not reversible procedure, and it is available for the male as well as for the female. Next, I am going to tell you the types of sterilization. Before only I have told you it is available for the male as well as the female. So we have two categories of sterilization. One is male sterilization, which is also called as vasectomy, and one is female sterilization, which is also called as tubectomy. So now we are going to study one by one what is vasectomy and what is tubectomy. So now we'll start with the vasectomy. First we are going to see the introduction. So vasectomy is also called as a male sterilization. It is a surgical procedure which aims to prevent the conception and prevent from the pregnancy. So as you know, it is a procedure where we are going to prevent the reproduction, and it is for the male. And the procedure is done by the doctor, mostly urologist, and in an inpatient department or a clinical setup. And in the procedure, the small tube, which are called vas deferens, are cut and blocked or tied. So this is what we have done in the vasectomy. The vas deferens will be cut and it will be blocked or it will be tied. So what happened? The semen, it will not be able to come out from the vas deferens, and it will be not able to reproduce the baby or getting a pregnancy. So this is the introduction of vasectomy. Next we have definition. Vasectomy is a surgical procedure for the male sterilization and a method of permanent birth control. It is a permanent, okay, like oral contraceptives and all. This is not a permanent method, it is a temporary procedure. But vasectomy or male sterilization is a permanent procedure in which the vas deferens of a man are tied and separated to prevent the sperm to entering into the seminal stream, which result to prevent conception. Next is case selection and indication, means for whom we can prescribe to go for this vasectomy. First point is the person are in a relationship and both the partners did not want any children, so they can go for vasectomy. They are in a relationship and any partners having health problem that would make pregnancy unsafe, so in that case also they can go for vasectomy. If one or both partners having any genetic disorder, so in that case also they can go for the option vasectomy. So these are the indication or when we can prescribe that you have an option for the vasectomy, because sometime if they don't have this condition, then also they can go for it and it will be problematic in their marital life. So in that case what they can do, they have to see this all the rules in what case they can go for, and if they have more, like if they have already 2 children, they don't want future like more baby, so in that case also they can go for vasectomy. So now I'll tell you what are the types of vasectomy. There are 3 types. One is conventional, one is non-scalpel, and one is minimally invasive. So first one is conventional. What is conventional or scalpel also? So this is the oldest method. Total 3 incision, one on each side and one in middle of the scrotum. Okay, 1.5 to 3 centimeter on each side, and closure by the sutures, and it is a high risk for infection. So the first one, no, it is like following in the old period where they are going to make 3 incision for it, but nowadays most of the time they are not following it. The second one is non-scalpel vasectomy. To special forceps, bus ring clamp on bus digestor, and it is less complicated and not required suture. So what happen, if you go for the second option, there is a less chance of infection as well as there is no need any suturing. The last one is minimally invasive. It is also type of non-scalpel where minor complication and low risk of infection. So these are the three types of vasectomy. Now I'll show you the that scalpel what I have shown you. One is this, a ringed bus forceps. This is one, and another one is bus dissecting forceps. These are the two Caesar, or you can say forceps, which used for non-scalpel. There is no need for any suturing. Okay, see here I'll show you that during the surgery what they'll do. There is two picture you can see, one is before surgery, one is after surgery. So before surgery there is a continuation of the bus difference, there is no cut. Okay, there is no this blockage. But if you notice in the after surgery, you can see here what they'll do, they'll cut in the bus difference and they will tie it. Okay, or they'll block it. So what happen, the semen or the sperm, it will not go through the female genital tract and the lady can't get pregnant. So this is the procedure of vasectomy. Next is advantage and disadvantage. So first we will start with advantage. It is an effective and permanent way to prevent the pregnancy for the couple who did want children, and it does not affect sexual activity, and more easier and less expensive than the female contraception. Next, coming to the disadvantage, it does not protect against STD, that is sexually transmitted disease, and other short-term risks are swelling, bleeding, blood pressure in the semen and blood presence in the semen and infection. So these are the advantage and disadvantage. Next we have certain complication like bleeding and bruising, infection at the site, a sperm leaking from a bus difference into the tissue around it and forming a small lump. So with this I have completed the vasectomy. Next I will tell you about the tubectomy, and which is female sterilization. Thank you.